Hi guys, this is Dr. Blevins with Enilda Clinic at enildaclinic.com, and today I'm going to talk with you about telehealth for therapy or telemental health and the benefits to utilizing this service if you need it during the coronavirus pandemic or COVID-19. So let's get started. Telehealth is whenever you're using video conferencing, or more recently, the definition has been, more lenient, and even just using a phone call to utilize therapy services. Traditionally, telehealth, though, is using teleconferencing where you have a visual and an audio component so that you and the therapist can meet and have a typical session. Of course, with some types of therapy, there might be a little bit of changes that are happening, but overall, the changes allow for a typical therapy interaction to occur. I focus on therapy with young children and doing parent training. So my therapy really focuses on giving parents a skill set so that they're interacting with their children in a way and managing the environment in a way so that their children are coping well with whatever the situation is, and so that parents are managing their stress as well as possible given the situation. Now, with coronavirus, we're doing a lot more telemental health, and I've done telehealth in the past for my client population, but of course I'm doing it a lot more now. And I wanted to just kind of talk to you about what that experience is like for me as a psychologist who does therapy, just so that you guys have maybe a little bit more familiarity with it in case this is something that you might want to pursue over the next few weeks or months, given how many stressors and changes will be happening to all of our lifestyles. So one of the big things is that I have not noticed a difference in the connection between myself and the adult patient through telehealth or in person. I was pretty surprised by this. Whenever I first started, I thought that, it would be really hard to have a connection with my adult patients, that we would be missing, the gist of what was happening, or maybe I would be missing little intonations or gestures that were going on. But as you can see, you can get like really close up, and so I feel like I actually get all of the facial expressions. I can pick up on a lot of information. So that visual component of telehealth is really important. Of course, if you already have a connection established in person, then doing telehealth through just a phone connection can be very helpful too. And I know a lot of therapists are doing that just because establishing telehealth through video conferencing can be pretty hard. My preference is to do it with the visual and audio connection so that I can pick up on all of that nonverbal information that's happening. Many times I'm working with both parents or two caregivers, if there's like a parent and a grandparent, or the child and the parent in the room at the same time. So I like to see the nonverbal information that's happening between the multiple family members. And so that visual dynamic is really helpful for me. And I don't feel like it's lost through telehealth, which has been really exciting because I feel like a good portion of the therapy process can be transferred over to teletherapy, telehealth, from an in-person setting. So to me, that's the most critical component of this, is that we don't want to do anything that won't be effective. The second piece is safety. Because I am working with young children, there are some procedures that I do, young kids can sometimes be pretty wild, where doing it in person is essential to maximize safety, to make sure that I'm able to demonstrate and model and give feedback to parents to maximize safety concerns. And so those would be pieces that for my telehealth practice, I could not do. They would have to be done in person. And so mental health is considered a part of the medical domain, and so it's considered an essential job function. So for some children out there, they will have certain types of behaviors that it will be critical that they're receiving services across the pandemic, and on a case-by-case basis, they might need in-person services, which I would evaluate at that time. But wherever possible, most of my clients will be receiving telehealth services, but I would not be doing any safety concerns or interventions like that through telehealth. I know there are therapists who practice with other types of populations where they also address the same factor of safety. And so they definitely take that into account, and they consider the different risks. And if they cannot mitigate those risks in various ways on a patient-by-patient basis or just with their population overall, then they don't do telehealth. And so depending on, what population they serve, they might end up still doing in-person services if that patient population has a medical necessity for services during the pandemic, or we might just have a delay in services until the pandemic, eases up. The next piece, now this is going back to my specific population of working with children and their parents, is that, and this is how I work in the therapy room anyway, in real, in person, is that I'm giving a lot of direction to the parent on what to do with the child. And so I will give suggestions for activities to do with the child. I will give suggestions for having different materials available for our next session so that we can do activities together, giving suggestions for the parent on how to manipulate different materials so that we can do more concrete types of activities in order to support the child's understanding and processing of the therapeutic information and helping them to develop insight and develop emotion regulation, things like that. So a parent is a true partner in the telehealth dynamic. In my practice, they're a true partner in the in-person one. I never do therapy with just the child in the room, because I'm focusing on parent training so that the parent really has the skill set to do emotion coaching across the week. So those are the big components there. I want to go into why you might consider a telehealth therapy session over these next few weeks or few months while we're in the pandemic. I think there's two ways to think about this. One is prevention and one is reaction. No judgment on either. It's not that one is better than the other. I think that we all understand that this is an unfamiliar situation, and we can try to be preventive and plan and try to maximize the outcome of having a successful home experience while we're all in isolation. And part of that might be that if you recognize that your child has specific needs, or even that you as a parent have specific needs that will be triggered or heightened during the isolation period, you might preventively have a consultation with a therapist in your state and talk through the planning process for how you can mitigate those concerns. Alternatively, across these next few weeks or months, you might start to notice that there is a new type of routine or interaction pattern, either between one or two kids, or between a kid and yourself, or a kid and another family member, where somebody is just not coping well, and a dynamic is starting to develop that you would like to have that stressor relieved. And that would be a reasonable concern to set up a mental health appointment. Given the amount of stress that's going on, I can speak for myself in saying that I'm doing one session consultations for planning. I'm doing a few sessions in order to target in on specific concerns, and I'm doing ongoing telehealth therapy for people who want to have that ongoing support for whatever need, whether it's related to the pandemic or whether it's related to concerns that were there beforehand. And so I think that many therapists are making themselves available and becoming very flexible during this time in order to be there for their community. And so reaching out to a psychologist or a counselor or a social worker, whoever is available and you feel fits the criteria for your needs, would be important in order to make sure that you're having success with your home life over this period of time. I think that, it's having a mindset that we're already dealing with a lot of stress, and there's no reason to struggle more than is necessary. And if this might give you a sense of support and ease some of your stress and struggle, then why not utilize that support since it is available? Okay, so that is my spiel on telehealth for therapy or telemental health. You can learn more about strategies to cope with the pandemic and strategies for child behavior and child psychology at enildaclinic.com. And I'll be posting here regularly for a couple of weeks about the pandemic. And then I post regularly about child behavior and child psychology all the time. So I will see you guys next time.